In our collaboration with Kaiser Health News and NPR, we're taking a look at surprise medical bills that catch many Americans off guard. The CDC estimates the biggest chunk of the nation's $3.3 trillion health care bill is for chronic illness. That accounts for 90% of the total costs. One of those conditions, multiple sclerosis, affects more than 2.3 million people. Without treatment, the neurological disease can cause disability.
The latest bill of the month reveals just how costly life-saving drugs can be. Shereese Hickson was bedridden with MS symptoms at one point, unable to work or care for her 9-year-old little boy. After trying 2 other drugs, a single mother's doctor prescribed an infusion called Ocrevus. Now, it costs $65,000 a year. Medicare and Medicaid paid for nearly all of her previous treatments, so she was very surprised when she was billed more than $3,600 for the first 2 doses of this new medicine.
When I received the bill and it said $3,000 pay immediately, and I'm like, where am I supposed to get this from? I'm on disability, and that would be 5 months of my checks.
Several weeks after calling the Cleveland Clinic and applying for financial assistance, Shereese's balance was zeroed out, but she still worries about charges for the treatments 2 times a year and the high cost of drugs for others with MS. The editor-in-chief of Kaiser Health News, Dr. Elisabeth Rosenthal, is with us at the table to discuss. So help us understand what happened to Shereese, because she got 2 infusions. They cost $123,000 a year. But why are infusion drugs, let's start with that, so expensive?
Well, because infusion drugs come with all these associated costs. You can't take them at home. I mean, you go to the hospital or an infusion clinic and you're in a bed. So basically, they're up-coded or upcharged. So it's not just the drug, it's the whole shebang you're paying for. So that's an important thing. Before she'd been on drugs, she could take it home.
And Shereese has worked in medical billing, which I also think is interesting, but even she was caught off guard with getting $3,600. And I think, Elizabeth, people would think if it normally costs $123,000 and you get charged $3,600, isn't that sort of a deal?
Well, that higher price is just kind of a notional price, right? Mm-hmm. And a $3,600 bill for any of us suddenly dropping in your box
is a lot.
It's a huge amount. You know, your kid doesn't go to summer camp or you know, you don't get those gym lessons you wanted to do. And basically why she was so surprised is she'd been on 2 MS drugs. They're all really expensive, but she'd never paid anything before. And part of the problem was that now she's on an infused drug, and that comes with all of these big charges.
Is the moral of this story, though, call up and ask about financial assistance? Because the Cleveland Clinic takes care of people. They have a pretty liberal policy in terms of taking care of people who don't have the means to pay, don't they?
They do. All hospitals have what are called financial assistance or charity care programs, but they're not going to offer those up to you. They're in the paperwork somewhere. They may be in one of those folders. So you have to ask. You have to say, is there financial assistance for me? And so she did the right thing. She picked up the phone and said, I can't pay this bill. What can I do? And the thing to remember is medical care is so expensive in this country that even if you make a decent income, you may be eligible. And there's a lot of discretion that the hospitals have.
Dr. Rosenthal, we would never go to a store and purchase a piece of clothing or a piece of food without looking at the price.
Exactly.
Or order at a restaurant. Why is it that when we go to the doctor, we are prescribed and order up treatments and medication that we have no idea what they cost?
Well, that's a big problem to me, right? We should be able to know, and no one told her. I mean, what the doctor is thinking, part of it is doctors aren't cost conscious about this either. He's just thinking there are 12 drugs to treat MS. They're all pretty good. The one she's on isn't working so well. Let's try X. But he's not thinking, oh, my God, X involves an infusion, and that's going to leave my patient vulnerable to all these other charges.
But the
he
whole
probably
system
doesn't
is so
know.
broken. I don't blame Shereese one bit.
No,
on
I don't
this,
either.
Because I have insurance through CBS, through United Healthcare. I go, my kids get preventative care, and I still get a bill over $1,000. And that's for preventative care. I mean, that's not even for a life-saving drug, and you still get. So every time you can't ask that, well, how much is it going to cost for you to take my child's temperature? Or how much is it going to cost to do the blood pressure?
Right, and I think if she'd asked her doctor, how much is this going to cost if I change to this new drug, he would have said, don't worry about it. I don't know. I'm sure it's the same as your old one.
You need it.
And, you know, he or she probably doesn't know either. The system is so broken, so dysfunctional, And, you know, I love this series.
So how do we
because we're
find
all
out, though?
sharing.
How do you know? You're saying the doctor. So how do we find out? The doctor
How do you
doesn't
know then? How do you know how much
yeah.
that drug is?
Well, she could try to go to Cleveland Clinic and say, how much is this going to cost? But that said, you know, she's a sick person.
She can barely get out of bed.
She wants to be treated. She's supposed to do like investigative journalism with Cleveland Clinic. So I think, you know, in other countries, there are binding estimates when you need a new treatment. It doesn't take detective work, and we should want that too. So I don't blame her for not asking in advance, because we're all so kind of, oh my God, they're not going to tell me, they won't know. I'm just gonna try and do what's right for my health. I have good insurance.
So, sorry, what
Fingers
should someone
crossed.
like Shereese do in the future?
And if you have a choice between an infusion drug, which is more expensive, or a pill, you should opt for the pill if you can.
Right,
correct?
and I think that's one of the lessons, that infusions come with all these costs. For many, many illnesses, there's a choice of an injection or an infusion or a pill. As an MS, you know, she should have her antenna up that the infusion's going to cost a lot more. And she is thinking now of going back to the pill, because she doesn't know if she can tolerate every
It's why the FDA
6
is publishing that it's pushing that the cost of this medication, these medications should be published in commercials and advertisements.
It is, but that alone, if they said to her, wow, this is going to cost $3,600, what's she going to do? She's feeling sick. Her doctor says you should try it. I think we need just a whole different system, because these drugs are more expensive in this country, $30,000 more on average than they are in any other country in the world. So we're being taken for a ride, and not just us, but sick people like Shereese Hickson, and that's not okay by me.
People know that's true. Elisabeth Rosenthal, thank you.
Thank you.